People wake up on a normal day and suddenly something happens that changes their lives completely.
Paediatric trauma call, 15 minutes.
A lot of really bad things happen to really good people, but you never think it's going to happen to you.
Stabbed 5 times, including chest, and has got an arterial bleed from his leg.
High-speed RTC moped into wall.
Jesus Christ, what happened? You all right?
I love my wife.
Any reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Complete baloney amputation of her leg.
I can't breathe.
He looks frail, doesn't he? He looks like somebody who's going to break.
It's going to be one of those days.
A place where life,
Darling, what's for dinner?
love,
Still as beautiful as ever.
We have a boy.
and loss
Don't make me cry.
unfold every single day.
And they said there's nothing they can do.
All the patients you're about to see were treated in just one 24-hour period.
You don't know how lucky I am to be talking to you right now.
We see situations where someone's life has just been turned upside down. People always try and remember what the last conversation was, or the last words that that person said to them. And I suppose it's so much nicer if the words that they remember are, "I love you."
Today's gonna be a good day.
Do you?
Yeah, I do.
I don't think it is.
Orthopedic St George's. I grew up in Mombasa, which is in Kenya. Being close to the beach, it's very laid back. I remember my dad once told me that the way in Mombasa is, why climb up to get a coconut when you can relax under a tree and wait for the coconut to fall down?
Orthopedic Registrar Avtar is one of the trauma team in Resus today.
Feel all right, yeah?
Yeah.
Wrist okay?
Yeah.
Sorry, my memory's terrible. What was your name? Kate. Okay, cool. Sorry, what's your name?
Jess.
Jess, okay, cool. So an orthopedic registrar primarily is responsible for looking after bony injuries. What's your regist's name? Sophie. So wait for your call, Sophie. I've always been a bit of an adrenaline junkie. If there's an adventure to be had, I'm usually the first one there. Because we'll just let gravity also help us. Kate, thanks. So I don't know if that relates to why I'm doing this job, because it does replicate that adrenaline, not knowing what to expect. Excellent job, ladies. There's so many things I've learned from being here. With the skill set you have, you can make a big difference.
Yeah, it's all done.
I thought it was very well done, guys.
Thank you.
Hello, St George's Resus. Oh, yeah. Yeah. 15. Okay, thank you. Bye-bye. Bye.
What we got?
Missed the hem for 24 to roof.
Roof, is it air?
Yeah.
Sorry, hang on a second, I've got 2 more traumas coming. How long is the landing?
15 minutes.
To land?
Yeah.
Okay.
Adult trauma call by air, 15 minutes.
51-year-old man is being rushed to St George's by air ambulance after falling 20 feet from a ladder at home.
Right, I need the trauma team to CT. Who have I got? You got another pair of hands?
Consultant Melissa is the trauma lead in Resus.
Right, can I just borrow one of you? Claire, can you do me Claire? Can I borrow you as soon as you're done with that?
I think probably quite a few of my colleagues might describe me as bossy. Certainly in this job, you do have to be direct a lot of the time because it is time pressured. You have to get on with things. There's no time for faffing around.
There's a HEMS one coming who's a fall from height. That's all I know at the moment, so we'll bring them straight to CT.
With HEMS, they tend to be patients with significant injuries. And certainly if they're coming a long way away, they're normally coming to us for a good reason because they will be bypassing other hospitals. We do tend to see people falling off ladders pretty much every day. I've seen a guy once fall just from a loft ladder just a few feet and have really awful injuries. And I've seen people fall 30 feet and they've barely got a scratch on them. Some people can just be lucky and some people are unlucky.
The man's daughter witnessed the accident and is travelling to the hospital by road with her mum.
We'd had this problem for a long time. The insurance people said they wouldn't cover it, and Dad took it upon himself to fix the problem. He was working onto the roof. I don't think any one of us realised he'd actually been up there all day. Before I know it, it's like everything stood still and he just went. He managed to grab onto the guttering. I remember seeing his feet touching the ladder and you could hear the clunking. Just trying to egg him on, trying to, move over, get to the ladder, and he can't do it. He just screams and falls to the floor. And I just remember looking down his body and seeing his feet twisted. And his bones sticking out.
Hello, we're going to go straight to CT if you guys are happy.
A man has been flown to St George's, having fallen 20 feet while repairing the roof of his house.
Have you got the form yet? Not yet. It's being done as we speak. We get some hands on once you're ready.
Everyone hands on, ready, brace and lift.
Excellent. If we get him straight off that scoop and get a hand over, please.
So this is Bob, he's 51. 90 minutes ago, he's fallen about 20 foot off a ladder on top of a roof, landing on some paving stones with query loss of consciousness. An open compound left fracture dislocation of his ankle. He's been stable. Of note, his wife says he does have a history of hypotension.
A compound fracture basically means an open fracture. The skin is broken. Either a wound from outside has cut through the skin or a bit of bone has basically poked through the skin and poked out.
His toes are a little blue.
A compound fracture is much worse than a simple fracture because it will take longer to heal and there is more risk of infection.
Hi, sir. My name's Aftar. I'm one of the doctors. Any pain in your chest? These injuries are what we call limb-threatening injuries. You have to give the patient antibiotics as soon as possible. Equal bilateral air entry. But still, if you haven't got on top of it, they may need an amputation.
Breathe in and hold your breath.
He's a very stubborn man, and if he wanted to go up there, he was going to go up there whether I told him or not. She felt very powerless. Sometimes I wish that there was more I could have done to stop him going up there.
that great? Come and watch this, Dr. Borg. You need to learn.
We might end up with a cardiac arrest round here.
Hit the charge button. Stand clear.
No shock advised.
No, that's wrong.
You can override it, can't you?
Yes.
Yes.
"68-year-old Anthony has come to A&E with a chronic gas problem. He's with his girlfriend Hon Yang, who is visiting him from China for the first time.
I just need to go and ask when I'm going to be seen, because I'm in real trouble. I'm sorry to bother you. When am I going to be seen? I'm in terrible trouble.
Still 5 patients ahead of you.
Oh, my
if
God.
If you're feeling unwell, I suggest you speak to one of our nurses again.
Okay.
Triage nurse, okay?
We had driven up to London because I wanted to let Hon Yang see London. She'd never seen London before. During the day, I was just burping and belching all the time. Well, I have to keep apologising. It is embarrassing, you know, flatulence and burping all the time. I had an interesting encounter where I was in a shop and I just had to belch. There was a lady in front of me who turned round and she suddenly said to me, "Oh, I thought that was a dog growling at me." Excuse me.
Yes, sir.
I'm in real trouble, actually. I need to be seen. I'm gathering there's 5 patients in front of me. I really need to be seen by somebody. Terrible pain and burping.
OK, if you take a seat for a moment, sir, and I'll see what I can do.
Thank you very much.
Unfortunately, it will be out of my hands whether it is till I can speed up the process or not,
Right,
OK? But I will see what I can do.
I need an antibiotic.
I know, sir, but everyone else here does need things too,
I know.
love.
I appreciate that, but I'm in real pain.
I understand that, I'll see what I can do for you, OK?
I'm burping like mad here.
I'm just going to put this warm blanket on you.
51-year-old Bob fell from the roof of his house, suffering multiple fractures to his legs and possible internal injuries.
I've heard that your wife is on her way. OK, so whenever she gets here, we'll let her in. So in the meantime, let's have a little look at your arm, see if we can get some blood out of you. How long have you been married for?
25 years.
25 years, wow. How did you meet? We can remember.
Yeah, it's a long story.
Oh.
I used to think that Bob was a bit of a ladies' man. He was Jack the lad. Couldn't stand him. I had a boyfriend at the time, and after I'd had a couple of drinks, I thought, actually, why not? So, naughty girl here. We got married in '87. Yeah, we'd only been together a very short time, really, before we got married. We had thunder and lightning, actually, on our wedding day. And my dad said to me, "You're going to be in for a stormy ride," he said. And I thought, oh, what's he talking about? Now it's later on, I'm thinking, maybe my dad was right.
Do you know what? You're so lucky that you've got such a good daughter. I'll tell you what else. You're never going up a ladder again. You might be laying there in agony, but I'm still going to tell you off.
He was a blind fitter. You know, he worked probably 6 days a week, sometimes 7 days a week if he wanted to.
You give us some grief, don't you?
Would you mind
given us something nice to think about for a change?
Well, I suppose like all men, you just want to feel that you're needed and you're useful, and work gives you that, doesn't it? They think, you know, they've got to keep on, when actually, sometimes if you're not careful, you're on life's little treadmill, you know, and if you lose sight of what you're holding on to, you fall off.
What am I going to do with you, eh? Promise me no more ladders, honey. No more ladders.
It's just such a shame that he spent all that time working and maybe should have slowed down a little bit and enjoyed life a little bit more.
This is so flipping lucky. That could have been your. That could have been it. Your head. How many close shaves are you going to have, my dear? Your stubborn pride. I can do it myself.
There's so many nasty people on television. I don't understand how they get there.
They're characters. People, if they were normal, they probably wouldn't make it onto TV.
Fair enough.
68-year-old Anthony is struggling with a chronic gas problem.
Christ, now, okay, let's go.
During the night, I have a situation where I go to sleep and I'll wake up probably around 3 times a night. When I wake up, I automatically start belching, and it could be 20, 30 minutes. I've tried all sorts of drugs to try and alleviate the problem over a number of years. There doesn't seem to be any treatment that really can actually cure it.
All right, thank you.
Honyang is basically my soulmate, my friend.
I'm okay, darling, I'm okay. I'm all right.
For many years, I had to look after my mother. I became her carer. And it meant that, of course, I had really very little social life. A Chinese friend of mine suggested that I go onto the Chinese internet. A lot of Chinese people are learning English. It's purely random, because there are about 500 or 600 million Chinese on the system.
Go to Beijing.
Yeah, like Beijing, no.
One day, up popped Honyang, and we started talking, and she said, I'm learning English. For about a year or a year and a half, we were just chatting over the internet.
I can't lie back, darling. No, I can't lie back. Need pillow.
You just get a feeling for people, don't you? I thought she was absolutely amazing. We just hit it off straight away. I never thought that would happen. As somebody that one's been looking for all one's life, you know. Very much so.
Hi, is this
Hi.
Mr. Dodd?
Yeah.
Hi, my name is Jay, one of the doctors. Nice to meet you. What happened, sir?
Well, I'm suffering from small intestinal bowel overgrowth, and this afternoon when I was in London, I spent 2.5 hours burping to get the gas out of my stomach. And the real key thing is that when I get the increase in gas, my blood pressure goes up, and I'm absolutely very concerned that I'm going to get a stroke, have a stroke.
Just going to make you lie down a touch flat.
Okay.
My father actually did in fact pass away. He had a stroke. And I have a suspicion, but he was of the generation that wouldn't talk about these things, that he had a problem, again, like this with his intestines.
Yeah, there, it's when you press it, it does hurt.
I could observe him sometimes holding his stomach and, you know, feeling very uncomfortable.
What I'm going to do is to relieve your discomfort because you got a huge gaseous distension of your stomach.
I know, yeah.
Is to try and
And
put
I cannot get it out.
Yeah, we're going to try and put an NG tube, okay? Which is a nasogastric tube, and then we can aspirate it.
Right.
And then we can get your gas out, and at the same time, whatever the liquid or stuff in there.
Okay, fine, yeah.
I'll get the nurses in to come and do this for you now.
Thank you very much, thank you.
What day is it today?
The 1st of July. Pinch punch, 1st of the month. No returns.
Ow.
Sorry. A&E St George's. Is it an adult paediatric? Okay, an adult trauma. Okay. Yep, that's an 83-year-old female, did you say? Yep, okay. A heart rate of 26. Yep. Thank you very much.
Fine.
Bye-bye.
Okay.
Adult trauma call, 12 minutes.
An 83-year-old woman has collapsed at home. She has a dangerously low heart rate and is being rushed to St George's.
A normal heart rate in an adult is 60 to 100, so a heart rate of sort of 20s or 30s is very low. You might be unconscious, your blood pressure might be very low, your heart could even stop completely if it goes too low.
I was in the kitchen, and she just got up the stairs, just a few steps. All I heard was, oh. She'd fallen down in a heap, you know. Said, I've hurt my head. So I thought perhaps she'd somehow broken her neck in some way, you know.
Have you got a scoop under there?
Yeah.
Where's Sophie?
Gladys, 83 years old, stairs. She can't really remember what had happened, but she knows that she fell backwards off the stairs, landing straight at the bottom onto carpeted floor, on her back and hit her head. She did have a CDA last year that left her with some speech kind of problems. She finds it difficult to get the words out.
But she's not confused?
No, not at all. And that's all we've got.
OK, thanks. Can we get her straight off the scoop, please? Thank you. Can we pop your legs down?
Gladys, can we just straighten this out?
Gladys suffered a stroke just over a year ago, and doctors need to discover if an underlying condition was the cause of her collapse.
When an older person falls over, you need to sort of think about, was it actually just a mechanical fall, or was there actually something more sinister?
About 30 is my count.
You really want to see whether they're stable, get them on a monitor straight away, get some basic blood tests, get an IV cannula in them so we can give them fluids or medication if we need.
Amazing, she's conscious of heart rate.
Shall we have some?
She's already had 1.2.
It's not do any harm to give her another milligram. And if it doesn't do anything, then that's fine. I'm going to give her half a milligram anyway. She's marginally faster, not a lot.
Her husband Ron has arrived in A&E and is waiting for doctors to stabilise Gladys's condition.
About a month or more ago, something happened. She couldn't understand what was happening, but she wasn't in any pain, but she just got confused. Here I picked the phone up and they said, oh, your wife's has had a bit of a turn, you know. She's had this stroke.
Go to the other one.
Oh, she's got such a nice figure. I think she's like proper hourglass.
Like a pear.
Gorgeous. No, hourglass.
Yeah, but like the top half is a pear and then it goes down.
If you... Not a pear. A pear comes down and then it goes out. She's hourglass. So a pear shape, right? They say a pear is that, right? Hourglass is that.
Got ya.
Is it going down? Yeah, I can't have it.
Just as a sharp scratch now. We're doing really well.
83-year-old Gladys was rushed to resus after collapsing at home. Doctors are trying to raise her heart rate before sending her for a CT scan to discover the reason for her collapse.
Who lives at home with you, Gladys? Your husband. And he obviously knows you're here then. Very good.
Gladys was originally married to my brother. He used to go out dancing. My brother never used to dance, so we did go out dancing, and things progressed from there. Latin American and quick steps and waltzes, that type of thing. So eventually Gladys and my brother divorced, but we still lived in the same house, but eventually my brother did move out. It was never nasty, but I think I always felt a bit guilty about it. So we don't see my brother too often, but I try and phone him every so often. And Gladys is the love of my life. It all seemed to have worked out quite well, really.
Okay, are you ready if I get your husband to come in?
Yes, fine.
Yeah.
Walter, can you come to triage, please? It's Walter to triage. Thank you.
Hello there, do you want to come with me?
Yeah.
God doesn't accept you find it.
You're right.
You find it all right. How did you find it?
Hey?
How did you get there?
I've used the sat-nav.
Oh, cool. I forgot that, yeah. Oh, you found it anyway.
The heartbeat was very slow earlier.
Yeah, it was, and it's come up a little bit now. Yeah.
"51-year-old Bob was airlifted to St George's having fallen 20 feet while working on the roof of his house.
As soon as I pulled up and saw an ambulance there, I said to Kate, Dad, better not have fallen off that ladder. And lo and behold, yes.
I knew something was going to happen because I knew Dad was going to fall from the roof last night because I was having nightmares about it because of what he did the day before with the chimney rest.
Can you tell me next time you have any little
Yeah, I
premonitions,
think I will.
please?
It wasn't till he decided to take a redundancy that he actually had more time at home. I do think he wanted to be doing something, and I think he wanted to feel useful. Everything that gave him enjoyment, he was no longer able to do. So I think that's why he was so keen to do the things around the house that he could do, or he thought he could do.
The amount of times it goes through my head thinking I wish that I'd told her to go and get Kate from school and I'd stayed at home, maybe things could have been different. But you can't turn back the clock. It's not your fault.
Bob has no internal injuries, but scans have shown debris deep in his wounds. Doctors are concerned he could develop a life-threatening infection in his broken bones.
There was significant contamination at sea. Articular surface was completely
exposed,
out, completely exposed.
Yeah.
So it's relative urgency in terms of what you decide to do with it.
Grossly contaminated, dirty, open fractures, that becomes an emergency. The clock is ticking because that infection then could spread around the rest of the body.
I'm just thinking, in terms of getting him straight to theatre, because if it sounds like he's got bilateral knees, bilateral ankles, he needs to be spanned from femur all the way down.
Those need to go to theatre almost immediately to then wash these wounds out and get the bones clean to prevent these complications of infection.
Does he need the surgery? Definitely. Is it time critical with the open fracture? Definitely.
Let me go up and see, because it might just be easier just to get him in and span him completely.
No problem.
Hello? Hi, mate. Sorry to trouble you. It's after the on-call trauma fellow. We're taking him to theatre in an hour for debridement. If you just want to stick your head in and say you know about it, and you'll be operating. Cool, mate. Cheers.
We need to stop you saying we.
Oh, that's never going to happen.
A wee glass of wine. Don't have a wee glass of wine, have a large glass of wine.
I tried drinking red wine out of straw for a while because I hated getting red lips and red teeth. And then I just started getting like a little red line here in the middle from the straw, so it just wasn't working. It's like, damn it.
Very bad, darling, yes, very bad.
Medicine no good.
Yeah, this minute, well, it was good, but it's not been effective. It's become tolerant to the bacteria.
Anthony is waiting for a procedure doctors hope will alleviate his chronic gas problem.
Oh, dear, 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 dear.
You no leave Chinese.
Sorry, no leave
No believe.
in Chinese medicine.
You.
Well, I do and I don't, you know. I'm sure there's a place for it, but I tried it, darling, and it didn't appear to work.
The one thing that I said to her, when we got together, I said, you've got to come to England, you've got to live here for a little while, and see whether you like it.
Here.
Yes, darling, I know.
Yeah.
Yeah, but it didn't seem to help, though.
But we found that it was very difficult for a Chinese individual person to get a visa. So finally, when it was possible, I then went to China. I got off the plane at Nanning after a 20-odd hour trip, and then went out into the general area, and there was Honyang jumping up and down. She was very excited. I thought she was absolutely fantastic. When she smiles, it's amazing.
I've been asked to put a tube to your nostril. Have you ever had this before?
I have in the lab, yes. I've had these
The tube is a bit uncomfortable. When it gets to your throat, I want you to just swallow it. Yeah. Thank you. Okay. Okay, just relax for me. Relax. The first bit is the main. No, that's not. It's not coping at all.
Oh dear. I'm sorry. Sorry.
Don't worry. Yeah, sometimes that's what they do, but sorry about that.
Okay, no, it's just the muscles were contracting. Oh dear. Darling, turn the light out, sit in a chair and have sleep. I sleep as well. I want to sleep. I want to sleep, darling. Sit in chair, sleep. I sleep. Close the curtain. No, just put... Oh, darling, don't worry about me. Just put it over there. I'm okay.
I will go to China, I worry you.
You'll worry about me. I know you will, darling. I have to get this sorted before I come to China.
The one thing I didn't want her to do was to come here and be unhappy and say miss her family and things like that.
You're a very beautiful, very lovely girl, darling. You're a very good girl.
If I had to, I would go to China to live, and that would be it.
And how? Well, Annie,
Yes.
very much.
It was a bit late for both of us, but we found each other, and that's all that matters.
Do you think you're a lucky man?
Yeah.
Because I love you.
Because I love you too, darling.
Anthony will be admitted to a ward to be given a course of strong antibiotics.
Ow! Ow! What's in your pocket?
Dickhead.
She'll either still be here or she won't have gone far. We'll be able to let you know where she's gone.
But they're going to put an authorized one on the system once they relook at it.
Yeah.
He's got bilateral calcaneal fractures, penile on this side, bilateral tibial plateau. So, and then we'll just plaster him upstairs.
Fine. So we've got a plan. What we're going to do, you've broken both your legs, you've broken the heel bones on both sides, and then you've broken both your bones just below the knee. So you landed squarely on your legs. So what we're going to do, because it's a bit kinder, is take you upstairs to theatres, put you to sleep, and while you're asleep we'll wash out the wounds and put you probably into temporary plasters to start with, and then you'll need some surgery at a later stage, probably next week.
Okay.
All right? You're going to be with us for a couple of weeks.
I'm not a clue.
Both legs. That's going to be very awkward now.
It was one of the worst injuries that I've seen involving both the lower legs. He had broken multiple bones at different levels, and that's a difficult situation to manage.
I'm not leaving you. You're not going anywhere.
Yeah, we're taking him now.
You're going, Dad.
Because they've only got a 20-minute window to do this op, so we need to take him right now.
We need to go. All right, I'll see you on the other side. Okay? Yes? Right.
Perfect. Thank you so much. Cheers, Dimos.
Surgeons must clean Bob's leg wounds to stop any infection before they can decide how to repair his fractures.
It's a long time when you're waiting, wondering how your life's going to change. And it's like, oh, God, you know, you're shaking and thinking all sorts of things go through your mind then, because you just don't know what's going to happen.
The damage to Bob's leg is so severe, surgeons decide to begin work to repair the shattered bones immediately. The medical team have stabilised Gladys's heart rate. Doctors have the results of her CT scan.
Hello. Hello there, how are you doing? So the CT scan's come back. It's just, as I said, you've got lots of arthritis in your neck.
but nothing else to see. Yeah, you've got some very nasty wear and tear in that neck, but no breaks.
Neither of you ever had children?
No, Glad had problems with one of the ovaries. You know, there was problems with me as well, so, I mean, you know, things never happened. Now, with this IVF, you know, it would have been a help, but in those days, this wasn't possible.
Nice and still, just for a minute. I'm sure that's a lot better, though, isn't it? A little dent in you, haven't you?
You know, she doted on her friends' daughters. And she likes to buy presents for other people's children. So we went to London last week. I mean, she bought a couple of things for the boys next door.
Did you bring any toothpaste as well?
Sorry?
You said about you put me some underwear, but you didn't you put anything else for me?
Anything
Pair of
else?
trousers.
Yeah, I couldn't find those West Ham things. Don't know where they were.
Yeah.
Shall I leave you the mobile phone?
Yeah. I'll speak to you in the morning.
I don't think we really had a row of any sort, you know.
Yeah.
Okay. All right. She's the love of my life. I think, you know, she wouldn't. I think I'd be really lost if she wasn't, you know, she wasn't there. Okay, great.
Yeah, okay. Okay. Yeah.
On the way on.
Yeah. I was okay.
Don't really want to think about it.
Bob has been in surgery for over an hour.
Been worried all the time, worrying about what the outcome is going to be for Bob's leg, and what's his quality of life going to be like.
Just finishing up in theatre.
Okay.
We've had to do a little bit more than just put plasters on.
Yeah.
Because it was a massive wound. We definitely need more operations. I don't think it'll just be one more. He may need serial procedures.
Before he comes home.
I think home we're looking at here for weeks.
Can you imagine how frustrated he's going to be as well? He's going to be really depressed as well.
Yeah.
We've bonded together to get through this situation, and I do think that it has made us realise, you know, just how much we do care and we do love our dad.
It'll still be a while.
Okay. Thank you very much. Thank you. Oh, it's going to be a long haul, isn't it?
When Honyang gets her visa, yes, we will be getting hitched. If I can control my my health problems, we'll go off to China next year, and we'll see the family and have a big celebration out there, I think.
I just feel that I've been very lucky. We've been together over 50 years now, and hopefully we've got a few more to come.
I do think that brought us closer together. We do need him, and sometimes you don't realise how much you need something until you think someone's going to take it away.